Pukeology podcast, where science meets your hilarious puke stories and the tips and tricks to stop that up chuckle that you need.
You never know what's going to spew out of her mouth. Here's
my mama,
Dr. Pukeology.
So coronavirus has become part of our genome, meaning it's something that we talk about all the time. You've heard it as COVID, corona, Rona, and it's now become a part of our genome, meaning that we are very influenced within our part as a virus, just like we get the flu shot because of the fact that the flu is a virus as well. So this is a different rapidly spreading subvariants from Omicron to Delta. I honestly think transformers every time I say any of those names. But pregnant women, they need to know the facts and whether they are at greater risk of contracting the virus while they're being pregnant. So let me, your favorite pregnancy doctor, walk you through the answers of the science that offer, like, are pregnant women more at risk for COVID? Are they eligible for the vaccine while they're pregnant and or the boosters? And are pregnant women exempt from wearing face masks? Do you want no more morning sickness, pregnancy nausea, or how about no more headaches and migraines? Visit our sponsor, nomonausea.com, the only natural way to stop nausea, vomiting, and headaches now, and get 25% off with the code PUKE25. That's PUKE25. Or just place us on your registry bag at Bye Bye Baby. You can find us at the grocery stores like Meijer and my favorite, Walmart. And again, you can get it shipped for free in just 2 days from Amazon. So you can have the one for yourself, one for your kids, No More Nausea kids, and No More Sleepless Nights kids. P.S. moms, if you want to get them to sleep, it also works for you too. It works for women with small wrists also, so you can get any of all of our products on Amazon as well. Now, do you want to hear some pregnancy humor that may just make you want to pee your pants? Like you don't have to pee all the time anyway, with hilarious puke stories like Booty and Brains, Puke Doodle, and Chipmunk Cheeks? If you want to learn more about your pregnancy, humor and knowledge is the key to help you survive these 9 months. And just know we're in this together. Today, you will learn the science behind the immune system changes during pregnancy, the firsthand knowledge of what to expect when you're expecting and or delivering, and breastfeeding while testing positive for coronavirus treatments. There are other preventions and options for pregnant women testing positive for COVID-19. My cousin was a perfect example, so I'm going to give you firsthand knowledge, not just as a doctor, but also as a loving, caring family member, as to, are pregnant women at high risk for COVID? Find out now in today's Pregnancy Pukeology podcast, episode 85.
The science of puke, Pukeology.
So, are pregnant women at high risk for COVID? Great question. If you're pregnant, you're probably freaking out, right? And you know that you've had a few sniffles and a few more sicknesses than you normally would. But does that increase your risk of COVID-19? It's also important to understand the impact that it has on you and your growing baby, right? If you want to learn more about this, you can always go take a look at nomonausea.com/health and wellness blogs, and you'll find a variety of different entities, just like some good natural remedies for pregnancy, all the way through to just what type of immune boosters can I use in order to help prevent me from getting the virus. Now, what is COVID-19? So coronavirus, also known as COVID-19, is a highly infectious disease that's caused by the SARS-CoV-2 virus. The disease spreads when a person who has the disease breathes out respiratory droplets that contain the SARS virus. After that, a healthy person contracts the disease when they breathe in the droplets, they put it in their nose, stick it in their eyes, or however they get it in contact with their actual bodily fluids. In addition, one can also get infected by touching each other from the nose, the mouth, the eyes of a contaminated hand. That's the reason why, I don't know if you remember, whenever COVID went crazy, right? You were seeing people wearing gloves. But it's very important that you are actually wearing gloves to protect yourself. You're actually not protecting the other people around you. And that was the whole point or purpose of having the mask, so that if you do sneeze, it kind of gets in the mask. Now, I'm not going to go into whether or not masks are going to be utilized, because remember, viruses are really itty bitty, teeny weeny, and they can actually go through the actual mask itself. But think of it this way. If I were to spit on you without a mask, I guarantee you get more droplet particles than if I spit on you with a mask on. Just saying. So COVID symptoms include a lot of the following. Like, they're very unspecified. There's a bunch of different variety, and there's a swing from one to the other. But most people develop mild type of infections, which could potentially go from moderate to severe diseases. So things included are fever. I know I personally had a fever of about 102 for a few days. Generalized body fatigue. That's that muscle aches. That's how you know the difference between a viral and a bacterial. The loss of smell or taste. If you are one of those, please let me know. I always say that was the good COVID. I unfortunately never lost my sense of smell or taste. So again, I still ate everything and just didn't work out because I felt crappy. Now, cough. Cough is another one that you'll see in a small proportion. Sore throat, skin rashes. I actually had Pukeology, which basically is like red welts all over my body after I ended up getting the COVID virus. So again, skin rashes, if you're prone to having skin disorders like eczema, psoriasis, you might actually end up getting that as well. Diarrhea, difficulty breathing, and confusion. And I want to talk real quick about difficulty breathing. In medicine, we learned so much about COVID-19. We actually found that it is a disorder of aggregation or of clotting. So what's happening is these people that have regular lungs, that they actually were literally throwing little microemboli, which just means a pulmonary embolism is like getting a piece of your blood stuck. And so if it gets stuck, it's kind of like, if your vacuum, right? If it gets sucked up against something, it can't work. That's exactly the exact same thing that's happening. Well, when your blood does that, it clots. And so we've now learned that whenever somebody does get severe enough that they have to go to the hospital, their pulse oximeter or the amount of blood oxygenation drops too much, they go into the hospital. When they go into the hospital, they'll give them a high dose of heparin before they actually are put on a ventilator. So what that just means is it keeps the blood nice and thin. And that's what we want. We want to make sure that there's no clots that are forming. And unfortunately, women, we know that take birth control that are within the ages of 18 to 40, they usually have a higher risk or propensity of getting blood clots. And that was something that's considered a contraindication for women if they do have blood clots and if they are on birth control. But none of you ladies are actually on birth control because you are pregnant. Okay, so what are the effects of coronavirus infection on pregnant women? So pregnancy usually comes with a lot of challenges. I've been pregnant multiple times, so I know. Usually you'll experience both immunologic and physiologic changes. Woo, those are big words, right? What immunologic means is that it affects your immune system so that you can preserve the baby. Physiological changes, on the other hand, is something that's much more indicative of your actual body mechanics. Things do change when you're pregnant, and it's not just your belly getting bigger. These changes make you much more susceptible to viral respiratory infections like COVID-19. But there is no scientific evidence that shows whether pregnancy makes you more susceptible to COVID as compared to the general population. But by nature of pregnancy, you are already immunocompromised. And no, I'm not saying that every pregnant woman is like an AIDS victim or HIV. I'm saying that your immune system is already naturally decreased because you are immunocompromised in order for it to function the way it should. You don't want to kill the baby in there, right? And so your body's natural response of anything that's growing, anything that is foreign to it, it's going to kick it out. Well, we don't want it to kick it out. We want to be able to progress and we want to populate. So a high fever during actual coronavirus can sometimes, like we were saying again, I'm so sorry, a high fever During the first 3 months of pregnancy, which is also named organogenesis. Organogenesis is basically about weeks 8 to 12, and it's exactly what that word says. It creates and makes organs, okay? So the baby is making their organs, and when you do have a super high fever during the first 3 months, this increases the risk of certain birth defects. Other adverse pregnancy outcomes that have been reported with SARS-CoV-19 are miscarriages, stillbirths, and with COVID, no adverse pregnancy outcomes have been directly reported. So I'm only giving you the evidence-based data that I actually currently have. And again, we're always learning and changing, so you'll have to kind of listen in for updates as needed. Now, pregnancy alters the immune system. A pregnant woman's immune system is at its heightened state between the first 12 weeks of pregnancy. In order to become pregnant, the embryo must successfully implant by the mother's flooding of the mother's immune systems into the cell. These actually end up lining the uterus of the womb, which causes an inflammation. So it makes it nice and sticky. So if you have the egg, which is fertilized, and if it drops down without actually getting stuck to the side, the baby won't progress. The baby will just end up in what we call a miscarriage. But at the time, whenever it comes down, your immune system causes it to create this massive inflammation, and it grabs a hold of the actual, of the baby, of the egg, and then it attaches to the womb lining. When that stickiness is fertilized of the egg, then organogenesis, the process of making organs, starts to happen. And we said that was between 8 to 12 weeks. So again, the mother's body system really wants to hold on to that egg, and so it will have its heightened stage of immunologic changes during those first 12 weeks. Now, the mother's immune system after the next 15 weeks is repressed or decreased in order to allow the baby's cell to grow and develop properly. A mom's immune system has to relax because of its baby's cells have antigens from the dad, or else it would be at risk from being attacked by the mother if their immune system was running at full speed. I'm going to give you an example, moms. Have any of you guys actually gotten the Rogaine shot? A lot of people don't really understand it. So if you are naturally somebody who has a negative blood, okay, O negative blood, for example, and you are mating with someone with an A positive, we want to make sure that you don't create antibodies against the baby, against the next baby. Because this baby, you could be like, okay, you know, I saw it was foreign, but once you see the same result again, the mother without Rogaine, without containing its antibodies, would end up attacking the next baby. And then these are the mothers, unfortunately, that were having multiple miscarriages there after the first baby. And that's because their husband has a different blood type than they do. Now, the mother and the child usually will never have their bloods crossed. But it's not to say that it doesn't happen. It's a very bloody mess. Whenever you are actually delivering, remember your body starts to increase its natural production of blood products of its own hemoglobin and hematocrit, anywhere between 500 mLs to about a liter, meaning that's why you get puffy. That's why you get swollen, because your body is getting ready for what could be a liter of blood loss already. I digress. Let's go back. So a mom's immune system has to relax because of some of the baby's cells have antigens from the dad. And then again, they would be at risk for attack by the mom's immune system if it was running at full speed. The mom's immune system kicks back into hyperdrive for the delivery as the inflammatory response helps with labor and produces more antibodies made by the mother. The more the baby receives via breast milk when they come out into the world. So breastfeeding mothers, it is important to feed every 2 hours if you are planning on breastfeeding, and that's because you're giving them antibodies. The good news is that what we've seen as a pregnancy doctor myself, we've been seeing that all these formula companies were all shut down, but luckily they're now running back in the United States. But again, what formula doesn't offer that a mother does offer is the amount of antibodies. So again, if you're breastfeeding every 2 hours, that's a great way to keep your baby getting the antibodies. They're getting your antibodies all through your breast milk. So are pregnant women at high risk for COVID? So let's go back to the initial question or conversation. The risk of being infected with COVID-19 while pregnant is very low. However, you are still at higher risk for getting sick than a non-pregnant person or a non-pregnant woman when infected. In addition, getting infected with COVID-19 virus while pregnant increases the risk of developing complications that may affect you and or the growth of your baby. Risk of getting a severe illness is even higher if you are pregnant and have other underlying conditions. So when it is like a combination, when you're diabetic and hypertensive and pregnant, boom, trifecta, not as good. Staying in a community with a high rate of COVID-19 cases and a low rate of COVID-19 vaccinations also places a higher risk of experiencing severe COVID infections. Remember, when you are getting vaccinated, yes, it is intrinsically for yourself, but you're also trying to make sure that you don't move forth that actual virus in a severe way. So we're trying to keep the symptomology lower. That's the reason why we've been getting vaccinations for flu shots, for example, for quite a number of years. And again, what it does is it takes the top three versions or the top three averages of the highest amount of viruses from the year before, and that's how they make the actual vaccine. COVID is no different, guys. It's going to be the exact same thing. They're going to end up taking the average of the total number of different types of COVID, because remember, your antibodies can tell the difference between family members, right? So if you have a mother, a father, you can probably put together which kids are theirs. Versus if you got some cousins down the line that you really, that are a part of the same COVID family, but they don't look exactly the same, those are the ones that you are at risk at still getting, even if you've been vaccinated. So I don't want anybody to think that just because they have the vaccine means that they cannot get COVID. It just means the symptomology of what you'll experience is less because you're getting a little bit of the live virus for your body to make the antibodies. Or if you've already had COVID, you've made the virus. And I honestly haven't met somebody who hasn't had it yet. So if you haven't, let me know. All right, transmission during pregnancy or delivery. Current studies show that pregnant mothers do not transmit COVID-19 during pregnancy or delivery. This is an area that needs way more research. Some peer-reviewed literature from 18 different studies has shown that a mother-to-a-child transmission of coronavirus does not occur. Now, 19 women with COVID delivered 20 babies. Of these 19 women, 3 were asymptomatic, so they didn't have any symptoms. 1 of them was admitted to the ICU, and none of them had maternal deaths. But again, guys, we're talking about 19 moms. That's not a big enough size to really consider this study as the end-all be-all. 15 babies who were tested showed no evidence of vertical transmission, which means from mom to baby. As a method of delivery was split 17 by cesarean and 2 by vaginal delivery. It is important to note that 42% of women hospitalized with COVID-19 had preterm deliveries, though. Only 1 neonatal death was recorded. No viruses have been detected in the amniotic fluid samples. So you will not pass the infection to your child while pregnant, during, and after the delivery. And I also want to kind of talk about again why the preterm is happening. Remember how we said that coronavirus or COVID is a perfect example of when your body basically is forming these aggregates, right? It causes you to clot a lot. So imagine your baby is considered an organ system. And by that I mean it is an extension. Your brain gets 20%, your baby gets basically 15% of blood flow, and all the rest of your organs get about 9 to 10% of blood flow. So what's happening is what happens when it clots, right? If it clots and your baby is not able to get the nutrients that it needs, then that's a problem, right? The placenta is blocked, and then that can cause preterm delivery just because your body is screaming, hey, get this baby out of here. I can't feed it any longer. And it could have been due to those little microclots. So inhaling respiratory droplets from a person infected with coronavirus remains to be the main route of spread of infection. Although infants born to mothers positive to coronavirus during pregnancy may have poor outcomes like premature symptoms or prematurity syndrome, it is not clear whether or not those outcomes are directly associated with the virus itself. Besides, the long-term health effects on infants born to mothers positive with coronavirus has not been shown. And I will give you my personal experience. So my cousin actually did have coronavirus when she was delivering. It caused her to go into the hospital hospital due to respiratory problems or symptomology. She was showing on her pulse oximeter in the 80s, which we don't want, right? We want to increase the amount of oxygen that she and the baby got. Good news is she delivered. The baby did not get COVID-19. She wore a mask the entire time. So now let's talk about transmission through breast milk. So no virus has been detected in the breast milk of mothers positive to coronavirus. It is therefore not possible to transmit the infection to your baby while breastfeeding. Human-to-human transmission of coronavirus is by close contact through respiratory droplets. If you are infected with coronavirus and you cough or sneeze while breastfeeding, you've now put your baby at risk for contracting the disease. So you actually will give your antibodies too. And we always say that her baby is really good. Everybody in the family, we did a big, huge family vacation. Yes, I'm Latina, so there's like 25 of us. And in that trip, all but myself, my little niece's dad, we were the only ones that didn't get sick. And she didn't get sick either, which means that she has the actual antibodies of a lot of different things because her mother was still continuing to breastfeed her even after she was over 12 months. All right, so now that was a lot, that was like a garbled textbook of everything, I think we need to get a little bit of some hilarious puke stories so that we can all enjoy them and laugh along. Let's listen up.
Throwing up on a Tuesday? One puke story.
After my second baby, I knew the headache was coming. These migraines were obviously my body's way of adjusting to its hormonal fluctuations post-baby. So when it hit, we went to urgent care. I left my baby at home with my husband and was so totally sad of not having her or having to leave her. I had to wait for quite a while at the doctor's, and then I started throwing up. The only thing I could think of to start doing was to go for a personal best. I hit a record that day, friends. 4 bathrooms, puking all my guts out. The doctor finally saw me, and thankfully it was my favorite doc, and I had to get a shot in my booty. Please, readers, see me as a 4-day postpartum mommy who just threw up in 4 different bathrooms and is now getting a shot in her rear. It is the only once that you've had to live through this, and you can laugh at yourself now. Thanks, Jane, for your hilarious puke story and a booty ease story all at the same time. I hope it helped to decrease your migraines. On Easter, I went to my friend's house since my husband was deployed and I was pregnant and couldn't enjoy all the festivities, and played video games while he ate with the whole family. Then he brought me this mountain of leftovers, and I ate it all. Later on, we went to the convenience store and I bought 4 Lunchables, which I knew was a pregnancy no-no, but soon enough I would learn that my body would reject it. I ate all of them in one sitting. That night he fell asleep on the floor, so I took the bed. Woke up at 4 a.m, leaning into the kitchen sink, puking my brains out. By the way, I used to sleepwalk. Went back to get into bed, and then I put my hand down, and it was inside of a big puddle of a big smelly pukey puddle. I clicked on the flashlight and saw the entire bed was covered in puke. I folded up the sheets, threw them in the laundry, and walked 2 miles home in my puke-covered pajamas at 4 a.m. This was definitely my favorite walking home puke story. EBENEZERSPL00GE. Woo! Thank you for your puke story. I definitely will think about that. I don't think it's been a little while since I've walked home in my own puke. My 2 brothers and friends of ours had just eaten at Olive Garden. I was driving. My brother was in the front seat, and my youngest brother was directly behind me. And our friend was directly behind my brother. I've been driving down the road for a few minutes when my friend looks over and notices my youngest brother's cheeks are puffed out. He asks my brother what he's doing. The youngest brother doesn't reply because he has a migraine from hell, but starts making desperate sounds and then just unloads a huge load of vomit directly to the back seat and down the pocket. Everybody starts screaming at me to pull over. As I'm pulling into a gas station, my friend in the back seat kid opens the door and pukes as the car is rolling across the parking lot. That's when my other brother in the front seat directly ahead of him opens the door and starts puking. Finally, after the car stops, the combination of the smells and sounds and sights forced me to open my door and vomit profusely in the parking lot. It was literally a counterclockwise train reaction of vomit. I was the easy one because I was pregnant and I knew I was going to Ralph anyway. A few days later, I paid a car detail to clean up my vomit mess. My car never smelled the same way again. Oh man, it was a few years before I could eat Olive Garden again. Thanks so much for that hilarious puke story. Now, do you have a super funny puke story that you just can't wait to share? Send it to me, please. Pukeology, Pukeology at nomonausia.com. That's NOMONAUSEA.com. Or tweet me at Pukeology so we can all have a good laugh.
Tips and tricks to stop the up chuckle that you need.
So everybody wants to know, when it comes to getting accustomed and it comes to getting comfortable, what do you do, right? What is the best course of action, and how do you stay as healthy as you can to build your own immune system? I can't stand it when everyone always says, okay, we're looking for a solution, right? Instead, we need to maintain our wellness and we need to help our bodies help itself. Now, if you are a person that's experiencing some nasty upset stomach, you can always go grab something in the natural realm. It's essential oil infused acupressure wristbands. Yes, I did invent them. They're called No Mo Nausea, and you can get them at Walmart, Meijer, you can get them on Amazon, things like that. And it stops 80% of people from puking, regardless of why they're actually nauseous in the first place. So let's look at different treatment options that are currently available for COVID-19, and then we'll talk about natural remedies at the very end to keep up with your wellness and immune system. While many studies have been conducted globally, there is still no definitive cure for COVID-19 infections. Therapeutic management of COVID-19 depends on whether the patient needs supplemental oxygen. According to the National Institute of Health, non-hospitalized or hospitalized patients who do not need supplemental oxygen require supportive care. These include rest in a prone position for a pregnant woman using a pillow with a cutout belly. Oh, by the way, prone is where you're face down, okay? Supine is on your hind. So again, we're saying to go prone. We're saying to lay forward and rest forward. But if you are pregnant, get like a donut that has a cutout so that you can comfortably lay and you're not laying directly on top of the baby. Isolation to prevent the infection, fluid intake to avoid dehydration. Staying hydrated is super important. I cannot overemphasize that enough. The use of over-the-counter medications such as painkillers, antitussives, which just is anti-coughs, right? To control fever, headache, malaise, and cough. Here are a list of EPA, which is Environmental Protection Agency's approved products that actually works on coronavirus and has been provided by the American Chemistry Council Center for Biocide Chemistries. I'm so glad I don't work for them. That would be way too hard. It's easier just to say the CBC. Avoid large crowds like sporting events, airports, and cruises. Avoid close contact with anyone showing symptoms of respiratory illness, such as coughing and sneezing. Avoid unnecessary travel, especially to regions or countries where the outbreaks have been recorded. Get lots of sleep, between 8 and 9 hours. Keep your stress levels low because the stress hormone cortisol actually lowers your immune system. I got a lot of cortisol. That's why I hoard fat too. Eat a plant-based diet full of colorful vegetables like fruits and high-fiber foods, and build your gut of your flora naturally, which increases the amount of vitamins, minerals, and immune function. If you're really curious on what you should be eating in pregnancy, go check out Pregnancy Pukeology Podcast, episode 16, and it will tell you a list of what you should be eating in pregnancy and what the actual eating does to it. So for example, most people don't know that there's a lot of iron in spinach. So if you are a vegetarian and you're not taking iron supplements, but naturally have a lower hemoglobin or anemia, you can just eat spinach like Popeye did, right? It might not get you the big old muscles, but what it will do is help you to be able to breathe better, especially if you have a low blood count. Now, anti-SARS monoclonal antibody products are recommended for outpatients with mild to moderate COVID-19 patients as a high risk of disease progression. Okay, these include different things like bimodal, also estabil, caricivil, plus indiamide and estrobovir. Those are all different. They're all different classes, but they are all within the exact same monoclonal antibody products, meaning one type of cloning of the antibody that is supposed to fight. That doesn't mean that it's going to work on all SARS, right? It's only for this one direct line. So the COVID-19 treatment guideline panel recommends against using the following drugs to treat outpatients with mild to moderate COVID-19 who are not in need of hospitalization or supplemental oxygen. So again, these are recommended. These are the COVID-19 treatment guideline panel recommended against. So what they're saying, don't do it. Dexamethasone or other glucocorticoids, because what do steroids do? They lower your body's natural immune system. Antibacterial drugs such as azithromycin. Again, remember, COVID is a virus, bacterial is different. And if you're looking for, do I have a virus versus a bacterial infection, go to pneumonausea.com and you can actually type that in and it literally says COVID-19 or something else. A chloroquinolone or hydroxyquinolone, antiviral agents such as Renovar or also Resomvar. All of these are other antiviral agents that are used for other viruses, but doesn't necessarily mean that they will function progressively in the exact same way. All right. So there are many ways that you can apply to avoid getting the COVID-19 infection, but most of these measures are all very easy to follow and do not require any sophisticated devices. They are wearing, a properly fitting face mask. Oh, here's one. Okay, guys. So I have a mask on and I'm going to show you. So if you have a mask on your chin, you are not protecting anything. If you have a mask on your eyes, you're not protecting your nose or your mouth. So make sure that it actually encompasses your nose and your mouth and it is form-fitting. The reason why is because if not, you can still get the actual sputum to ploop and plop to somebody else. Okay. Avoid being in these massively crowded areas. You never know what the next person has next to you. Covering your mouth or nose when you cough or sneeze. Do what I tell my kids. Vampire cough. Woo! Right? Or vampire sneeze. Everything is you basically cough or sneeze into the fold of your arm. Kind of think of like your elbow, the inside of your elbow area. Regularly washing your hands. Washing your hands is super important. Do you know the number one antiseptic? What that is? Running water. You got it. All right. The use of alcohol-based hand rubs, those will also help to make sure that we get more of everything, the bacteria that we have, that it could be on our hands that could also progressively make us worse. Now, if you are a person, it's very common to actually have either a bacterial infection that then leads into the actual COVID-19 virus and or the COVID-19 virus and then ends up being bacterial nearing towards the end, because your immune system is lowered. That's how I knew my husband ended up getting the COVID-19, because he had pink eye. And no offense, like, you as a grown man should be able to wipe your butt and wash your hands thereafter. So I wasn't really thinking that it was anything in that sort of fecal content. Instead, it was his body's way of just being so immunocompromised at that point in time that it was easy a penetration into COVID-19. All right, so are pregnant women eligible for a COVID booster? COVID-19 vaccines help to protect against COVID-19 infection. Vaccines work by helping your body build immune protection cells specific to COVID-19 infections. Pregnant women are eligible for COVID-19 vaccinations and the booster. Always ensure that you see a doctor's guideline as to which booster and when to receive it during your pregnancy. So go to your OB, talk to them. It's cool. Talk to them, we talk back. All right, I'm not going to bore you with my terrible singing voice. All right, last but certainly not least, everybody asked me this, sometimes you just feel like you can't get enough air. Why? Because you got a baby that's literally sitting way up high, your diaphragm is affected. you got to pee all the time, you're not getting the sleep. So patients always ask me, are pregnant women exempt from wearing face masks? Pregnant women are recommended to follow the measures used by the general public to prevent the spread of COVID-19 infection. Therefore, it is necessary to wear a mask or at least a hands-free covering when you are pregnant. Wearing a face mask will protect you and ensure the safety of other people. But I do understand if you were to take a pulse oximetry of how much blood oxygen that you're getting, when you do have a mask on, it increases the amount of carbon dioxide that you're breathing in. Most pregnant women are healthy young women who just happen to be pregnant. So for you, there's no necessary guidelines or there's no necessary issue with increasing the amount of CO2, which is the stuff that we breathe out, increasing that concentration in your body, and also lowering your oxygen content just a little bit. So again, for most pregnant women, it is. Now, I hope you all have really enjoyed. I have been able to tell you guys a little bit about COVID-19 that hopefully none of you guys actually knew. So the question that I hope I was able to answer, are pregnant women more affected by COVID-19? And the answer is yes, because of their immune system. You also found out that you can't transmit COVID-19 inside of the breast. Instead, you will get the antibodies when breastfeeding your child and some coronavirus treatment and prevention options for women testing positive for COVID-19. Thank you all so much for listening to Pregnancy Pukeology podcast. If you love me and everything that I just said, let me know. Give me hearts for likes, and or likes or stars or thumbs up or whatever it is. And remember, don't forget to download this episode, right? But more importantly, share it with all your prego friends. Thanks again for listening to Pregnancy Pukeology podcast, episode 85. Are pregnant women at high risk for COVID? And the answer is yes. Join us next time as you will get some more information of pregnancy because let's face it, we're in this together. Thanks again.
Pukeology Podcast, edutainment at its finest.